Hello, everyone. My name is Danielle Cunningham, and I am the trainer that is going to be leading you through our Understanding Boundaries training. So, as always, we want to go ahead and start off with the objectives of this training, and they are to define and identify 6 types of boundaries, understand the relationship between boundaries and values, learn the importance of setting healthy boundaries and discuss barriers, and learn how to assist residents with setting boundaries. So, just a quick disclaimer here. In this training, we will discuss the more common and general boundaries that staff should be mindful of when working with residents in LTC facilities. So, staff should adhere to the established rules and guidelines set by your workplace, ensuring to perform tasks and conduct yourself in a manner that aligns with the expectations outlined in your company's official documents. So, please ensure that you are following your facility's policies and procedures. So first, we want to go ahead and start off with defining what a boundary is. And so it is the limit you set for yourself that defines what you are willing to do, accept, and tolerate. It protects your right to have your own thoughts and feelings and guards them from being criticized or invalidated. And so boundaries are essential to having strong and healthy relationships. They are the lines and limits residents create between themselves and other people. And it also allows residents to define what is acceptable and healthy for them in their relationships, whether this be with friends, partners, coworkers, bosses, or family members. And so the boundaries residents communicate and maintain can protect them both physically and psychologically. Boundaries are also safeguarded their time and material possessions. So having healthy boundaries means establishing limits and clearly expressing them. Ideally, boundaries are put in place to protect one's well-being, and they can help build trust, safety, and respect in those relationships. So now we're going to talk about the 6 types of boundaries. And so these are, we're going to discuss how staff can make residents aware of the different types of boundaries and how they can assist residents with setting those healthy boundaries. And so a key to healthy relationships is teaching residents how to establish boundaries. So as discussed earlier, boundaries are expectations and needs which help a person feel safe and comfortable in their relationships. So here we're going to discuss the 6 types of boundaries, and they are intellectual boundaries, emotional boundaries, sexual boundaries, time boundaries, material boundaries, and physical boundaries. And so these are boundaries that apply in all relationships, but they may show up differently depending on the setting. So we're going to break these down in our next couple slides. And we're firstly going to start with intellectual boundaries. So the first type of boundaries are intellectual boundaries. These are also known as personal boundaries. Now, intellectual boundaries are the guidelines for how your residents think and express their ideas, how they respect ideas of others. And intellectual boundaries are the rules that govern how we think, perceive, and share our own ideas. They are also known as mental boundaries. So feeling comfortable expressing your own ideas if they don't harm others, but also being aware of what is appropriate to discuss in each situation. So residents can show they have intellectual boundaries by being willing to listen to others without dismissing or belittling another person's ideas or thoughts. So you may hear some language like, I know we disagree, but I won't let you belittle me like this. Or I can respect that we have different opinions on this topic. So intellectual boundaries are respecting the ideas of others, expressing your own ideas, and being aware of what appropriate topics to discuss. Now, intellectual boundaries are the ability to define and determine one's beliefs. It is about knowing that knowing your own thinking is your own, regardless of what others think. Now, intellectual boundaries are the preference related to how opinions, thoughts, and conversational topics are shared and addressed. So your residents should feel comfortable expressing and sharing their own ideas if it does not harm other people. Now, residents setting intellectual boundaries should be aware of what conversations are appropriate to discuss in a given situation. So, would it be appropriate at this time to discuss politics, or is weather a better conversation to discuss? But residents also have the right to disagree, but you want to pay attention to avoid speaking demandingly or negatively off of someone's own beliefs or interests. So next is going to be emotional boundaries. Now, emotional boundaries are limits that help protect your emotional well-being and ensure that others respect your feelings. They can be applied in many types of relationships, including romantic, platonic, familial, and work-based relationships. But establishing emotional boundaries involves taking ownership of your own feelings and not being made to feel responsible for other people's feelings. Now, with emotional boundaries, this can refer to a resident's personal space, feelings, privacy, and anatomy, but also ensuring that staff do not overstep by imposing their own emotions or expectations and instead provide support while maintaining a professional distance to protect the resident's emotional well being. Essentially, treating each resident with respect and allowing them to express their emotions without feeling pressured or intruded. So, when we look at emotional boundaries, this can help your residents regain a sense of stability in their life. They can also lead to healthier connections with people in their life. So, by setting expectations around the behaviors you will and won't accept. So, setting expectations, you can say it is not acceptable to me that you call me names. Learning to say no, you can learn to say no so you don't give too much to others and nothing for yourself. Not oversharing. You cannot overshare private details from your personal life with acquaintances or coworkers when you don't want to. And then not responding right away. So you do not have to respond to work emails right away. Or sometimes it may be best to kind of get up and walk away and just take a breather away from work related emails. Now, a healthy emotional relationship between two people is like a Venn diagram where there's a clear distinction that my actions and their actions exist in a clearly defined space. We are not in a constant state of acting or reacting. So, an emotional boundary is a distinct separation of one's own emotions from another. It is the clarity around the fact that no one else's emotions are mine and my emotions are no one else's. So having a healthy emotional boundaries prevents you from giving advice, blaming or accepting blame. They protect your residents from feeling guilty from someone else's negative feelings or problems and taking others' comments personally. And so when they have healthy boundaries, this may require some for them to have some clear internal boundaries. So knowing their feelings and their responsibilities to themselves and other people. So having healthy emotional boundaries, it is being responsible for my feelings, my actions, my job to save myself, and other people's emotional boundaries are their jobs to save themselves, responsible for their actions, and responsible for their feelings. Next boundary is going to be time boundaries. So, time boundaries are limits that help you manage your time and protect your energy. They can help ensure that your residents have enough time for what's important to them and can be applied in all aspects of their lives. So, time boundaries are the limits you set on how much time you spend on different tasks, activities, and relationships. They can help you prioritize your goals, protect your energy, and avoid burnout. So a person must set aside adequate time for each aspect of their life, such as work, relationships, and hobbies, to have time to set those time boundaries. So conversely, time boundaries are breached when someone demands too much of another person's time. So when we look at time boundaries, we look at work. So this can look like set aside some time for work calls or only taking calls during certain hours. Personal life, this can look like setting aside time for relaxation, hobbies, or spending time with family and friends. Communication, this can look like setting time to limit phone calls with family or friends or set cutoff times for talking on the phone. And then social media, this can look like the limit how much you spend scrolling through social media. But some other tips with time boundaries is practice saying no. It can be hard for residents to say no, but it is an effective way to create more time for themselves. They can try saying things like no, thank you, or not today, or I'm not interested. Communicate clearly. When someone asks you to do something you can't or you do not want to do, be honest and explain why. And then delegate tasks. Ask for help or for someone else to take over a task so that you can focus on other things. So, setting time boundaries can help your residents improve productivity, creativity, and quality of work. It can also improve their relationships, communication, and collaboration with others. Next is going to be material boundaries. And so material boundaries refer to money and possessions. Healthy material boundaries involve setting limits on what you will share and with whom. So, for example, it may be appropriate to lend a car to a family member, but probably not to someone you met this morning. This also helps prevent resentment and causing your residents to have additional problems. So, for example, if you don't set boundaries around household labor, then you might end up resenting your partner. So, having material boundaries protects your finances and your possessions. This can include freedom to spend your money the way you want or need, having that employer or employee agreement on around your pay, and not giving out your money or possessions unless you choose to. So, some examples here. We've agreed to have designated quiet hours from 10 p.m. to 8 a.m. each night, where we try to keep noise levels low to respect each other's sleep schedules. Or, I don't mind sharing some items with you. I just would appreciate if you ask me first. Just making sure your clients are setting boundaries around their material and possessions. And then lastly, there is going to be physical boundaries. Now, physical boundaries refer to personal space and physical touch. So, having healthy physical boundaries include an awareness of what is appropriate and what is not in various settings and different types of relationships. Now, these can also refer to the limits of a physical space or object or to personal space. So, some ways to help your residents identify their boundaries can include tuning into their emotions, tuning into their thoughts, and then asking others and getting clear on what their values are. So, when we look at personal or shared space, this is the area around a person that they consider to be their own. So, for example, walls define boundaries of a room, and fences act as a physical boundary for a yard. So, residents most likely have a shared space, and communicating to their roommate what their physical boundaries are is important to foster a healthy relationship. Now, when we look at physical touch, this can look like what is appropriate and what is not appropriate. So, for example, is it appropriate to hug, do some handshakes, or is it appropriate at that time and situation to kiss someone? When a client does not have good physical boundaries and when they are violated, is when someone touches you without your consent or invades your personal space. So, physical touch boundaries can also include what boundaries residents have when they are grooming, engaging in hygiene tasks, how you position them, or what is comfortable for them. In bed. So it is good to ensure that you are asking these questions to your residents so that they feel comfortable, or at least walking your clients through what you're doing so that they are also comfortable. All right, so now we're going to go into professional boundaries and how staff should adhere to the boundaries in their specific settings. So, looking at staff boundaries in LTC settings. So, staff boundaries in long term care facilities, this refers to clear limits and guidelines that workers must maintain in their interactions with residents. Ensuring a professional relationship that respects the resident's privacy, anatomy, and dignity, while also protecting the staff's potential ethical or legal issues. This includes limitations on physical contact, personal disclosure, gift giving, and always maintaining appropriate physical and professional conduct. Now, some key aspects to staff boundaries can look like physical boundaries. So, this is only touching a resident needed for care, following proper procedures, and respecting their personal space. So, avoid any unnecessary physical touch like hugging or holding hands without your resident's consent. Emotional boundaries. So, this is not engaging in overly personal conversations or sharing personal problems with residents. So, maintaining a professional demeanor, even when dealing with challenging resident behavior. Communication boundaries. This can look like using respectful language and avoiding gossip or negative comments about residents, protecting resident confidentiality by only sharing necessary medical information with authorized individuals. Financial boundaries. This can look like, again, not accepting gifts or loans from residents unless allowed by your facility's policy, and avoid any personal financial transactions with residents. And then social boundaries. So, not engaging in social activities outside of work hours with residents without appropriate supervision, and maintaining appropriate boundaries on social media platforms as well. And then material boundaries. And so material boundaries typically refer to physical and tangible interactions or exchanges that staff may have with residents. And so these boundaries are meant to protect the dignity, anatomy, and safety of both the staff and the residents. So staff should respect the personal property of residents, ensuring that any personal items are handled with care and are not taken or used without consent. So this can include clothing, electronics, or any other personal belongings. So no lending or borrowing from residents and vice versa. And staff must respect the residents' personal space and only enter private spaces such as their rooms when necessary for professional reasons like caretaking, doing safety checks, and things of that sort. So why are staff boundaries important? So it protects the residents' safety and well-being. So having clear boundaries protects residents from potential abuse, exploitation, and or manipulation by staff. Looking at professional integrity. And so this is important because it helps the staff maintain boundaries that upholds the ethical standards of healthcare practice. Legal protection. And so proper boundaries can help prevent legal issues related to staff conduct and staff well-being. Clear boundaries can prevent caregiver burnout and stress by setting appropriate limits. So just a reminder that staff should be adhering to the established rules and guidelines set by your workplace, ensuring that you are performing tasks and conduct yourself in a manner that aligns with the expectations of your company's official documents. So ensuring you are adhering to the policy and procedures of your specific facility. Now, how can staff maintain boundaries? So again, looking at facilities policy. So adhering to the established policies and guidelines regarding resident interactions, looking at some different training, so regular education on professional boundaries and ethical conduct, reporting concerns, so encouraging staff to report any potential boundary violations to supervisors and open communication. So maintaining open dialogue with residents and their families to address concerns regarding boundaries. So next we have a video here. And so now that we've learned the importance of setting and maintaining boundaries with residents, here's a video that is going to role play how to set boundaries with your residents.
Hi, Pam. Thanks for coming in.
Hi, Francis. Good. Glad to see you.
Yes, nice to see you as well. What I wanted to talk to you about is the number of times that you're calling me throughout the day as well as after hours. We need to make some agreements about the amount of times that you call.
Well, but you said I can call you when I needed something, and I only call you when I need something.
Yes.
You know, and at the time, it's, you know, I need help.
Okay.
You told me to call.
I hear that that things are going on, that you need help with some things. However, I'm only able to respond to your calls once or twice a day. So the after hour calls, I won't be able to respond to until the next day. And then if you call me, I will respond to that call, or you could call with an update, right? If something has drastically changed.
So if I can't get into the doctor that you made an appointment for, can I call you then?
Well, I think a better strategy would be contacting the clinic, right? Because I'm not able to, I would do the exact same thing that you would do, is to call the clinic because you're not able to get into the clinic.
Well, how do I call the clinic if I don't have their number? Can't you call for me?
Well, why don't I help you in this way? I'll give you the after hours number to the clinic and also the nurse advice line. That way, if you have some issues regarding the clinic, you could contact them. But you and I need to agree on the amount of times and when you're going to call me.
Well, I mean, I can try that, but, you know, will you call me back?
I will, but I'm not able to return multiple calls, which is why I'm asking you to call me once or twice if there's an update.
Well, we can try that.
Okay.
We can try that.
How do you feel about what I've asked?
Well, I'm a little nervous because, you know, things come up for me during the day and you know, sometimes I just need to talk to somebody.
Okay.
I need to talk to somebody.
Okay. Well, What about we try a number of things? If you have something that you would like for me to work on with you, call me. Only call me a second time if there's an update. If there are other things that are going on with you, let's try to use like note taking to write down those things. That way you won't forget. And then when I call you back, we could talk about those things.
Well, that seems like I could try to do that. I can't guarantee anything, but I can try it.
That's okay.
Try it.
I'm glad to hear that you're willing to try it.
Okay.
All right.
All
So
right.
I'm just going to go over our agreement. You're going to call once a day, not after hours. If there's an update, that you'll call me a second time, and then you'll try to take notes. That way, when we connect with each other, you'll have everything down that you want to discuss. Do I have that right?
Okay, I can only try.
Yes, that's all I'm asking.
All right. All right. Thank you.
Alrighty. So when we look at residents and setting boundaries in long-term care facilities, this can also apply for a resident who may repeatedly push the call button, or a resident whose family member calls the facility repeatedly. So this can apply in your setting or any setting. Staff may have to set boundaries over and over and over, especially for residents who have memory impairments. And so we may need to educate on what boundaries are for those residents that don't understand how to have boundaries. And so when you're setting boundaries with residents who have memory impairments, such as those with Alzheimer's disease or other forms of dementia, may require sensitivity, patience, and clear communication. So memory impairments can make it challenging for individuals to remember rules or understand boundaries. So staff must be consistent and compassionate while still maintaining professional and ethical limits. So some items to assist with memory impairments can be having a routine that is easy for your resident to remember. Residents with memory impairments often feel more secure and comfortable when they know what to expect. Consistent routines and predictable interactions help reinforce boundaries without overwhelming them. And so staff should also use clear and direct, and in some cases, repeated language with residents. So repeating key points regularly can help reinforce understanding, even if they forgot. Repetition of boundaries may also help them feel more secure. So just ensuring that you're just doing a little bit more, especially for a client who has a memory impairment. All right, so now we're going to talk about power dynamics and boundaries. And so why do power dynamics exist? Power dynamics and boundaries are closely intertwined, especially in settings where staff interact with residents in vulnerable situations. The power dynamic refers to the balance of power between individuals in relationships or interactions, where one party, often the caregiver or staff, holds more control or authority due to their role, knowledge, or position. So in these contexts, boundaries are the limits set to maintain professionalism, respect, and ethical behavior. So this is particularly prevalent in relationships such as doctor-patient, teacher-student, employer and employee dynamics, where the professional is expected to have a greater expertise and decision-making power than the non-professional. So when we're looking at those power differentials, so looking at doctor and patient, so a doctor has more medical knowledge and authority to make treatment decisions. Looking at teacher and student, a teacher has more power to grade assignments and influence a student's learning. Employer and employee, an employee has the power to hire, fire, and set work expectations, and even power dynamic in parent and child relationships. So a parent has legal authority and responsibility for that child's well-being. Now, staff holding a position of power can create a potential for abuse, manipulation, or inappropriate behavior. So power imbalances can make it difficult for residents to assert their needs or say no, leading to blurred lines between professional and personal relationships. So some important considerations here is the ethical use of power. Now, while power differentials exist in many situations, it is crucial for a person with more power to use it ethically and responsibly, considering the potential impact of the other person. And then recognizing power imbalances. So being aware of power dynamics in relationships can help individuals navigate interactions and greater sensitivity and respect. Now, looking at the increased risk for boundary violation. So, people in power may feel entitled to cross boundaries, engaging in behaviors like making inappropriate comments, demanding personal favors, or exerting undue influence on decisions due to their authority. This can also look like difficulty speaking up for some staff. So staff with less power may hesitate to report or challenge a boundary violation from someone in a higher position due to fear of repercussions. And then the impact on mental health. And so experiencing boundary violations from someone in a position of power can lead to stress, anxiety, and a decreased job satisfaction for those affected. So, in the case of power dynamics, it is not possible for a staff member to be equal to a resident. As a staff, you want to establish a healthy professional boundary so that the power is not abused. So, clearly define your roles and responsibilities, set clear communication guidelines, protect confidentiality, maintain physical interactions, and avoid dual relationships, and monitor emotional involvement. So, power should be used to advocate and help the resident. So, being aware of your power differential in the beginning of treatment is very important. So, some important considerations: maintain confidentiality. So, always protect resident information, respect their privacy, following your company's policy. Know your limitations, so be aware of your own professional boundaries and refer residents to other professionals when needed. So stay within your scope of practice. Be mindful of power dynamics. So ensure that your interactions with residents maintain a balanced power dynamic. Again, referring to that disruption, exercise, or negotiation of power between people, groups, or entities. And so it is a complex concept that involves the relationship and interactions between people. It can include factors such as authority, influence, dominance, privilege, and communication styles. And then set boundaries for yourself. Protect your own time and energy by managing your workload and setting appropriate limits. Now let's go ahead and help our residents set and maintain their healthy boundaries. So first, why? Why is it important for residents to set healthy boundaries? So when residents set healthy boundaries, it helps them feel empowered and improve their self-esteem and self-worth. And so when boundaries aren't set, your residents can feel taken advantage of, drained, or resentful. And so here is a little video that we're going to play that is going to help your clients set those healthy boundaries.
Imagine you created a beautiful garden, but you notice people walking through the grass, littering, or even picking the flowers you've grown. So you put up a fence to mark what is your space, and you now decide who can come in through the gate. This is how we would protect our garden, and is also how we should protect ourselves, by setting boundaries. Boundaries are limits we set for ourselves within relationships, be they romantic, professional, friends, or family. You want to clearly see where you end and someone else begins.
I describe boundaries like a roadmap of me showing you how best to have a relationship with me. It is me clearly expressing and communicating my values and preferences because I want you in my life.
Some examples of boundaries are physical boundaries, what you are comfortable with in terms of your own space and your own body. Emotional boundaries, what you are comfortable with sharing and what you would like to keep private. And time boundaries, how you would like to prioritize your own time and where you would like to take time to rest.
An example of a request would be, please stop raising your voice. An example of a boundary would be, if you continue to raise your voice, I'm leaving. That would be me clearly expressing my thoughts and feelings, being aware of what I'm responsible for, and being aware that I don't need to explain my no.
Boundaries are something that everyone can benefit implementing in their life because they not only protect our time and energy, they also protect our relationships. They prevent miscommunication, misunderstandings, and built-up resentment. But what about when someone doesn't respect the boundary?
What's often difficult for people is what to do when somebody violates or oversteps a boundary. And if we use the earlier example that if somebody was to raise their voice at me, I am responsible for protecting myself. A lot of people fall into rescuing or fixing the other person, whereas that is up to me to protect myself. And if you continue to raise your voice at me, I leave.
If you feel like you need support, please contact your local mental health.
Alrighty, so let's discuss the importance of residents setting boundaries. So setting boundaries allows your resident to actively participate in relationships and support others while maintaining clear limits to protect their own well-being. This ensures they don't become overly burdened or sacrifice their needs to please others. So setting boundaries can help your residents create authentic experiences and connections by helping them feel respected and safe, and by helping them protect and nurture themselves and be understood by someone else in a significant and empowering way. So boundaries are guidelines for how someone wants to be treated. They help someone feel empowered and give someone permission to say no. When someone does not set boundaries, they may feel taken advantage of, drained, and resentful. So some examples there is showing up for yourself. So this can look like actively being present and supportive for someone, especially during difficult times, which can include things like offering a listening ear when they need to vent, helping them with the task that they feel overwhelmed in, and just attending to that significant event and just showing that support, or simply just checking in just to see how they are doing and making sure that they are doing well. So essentially, we are demonstrating that you care and are there for them when they need. Continuing on with the importance of them setting boundaries. Now, setting boundaries are important because they will help your residents push back against unreasonable expectations. Boundaries allow residents to practice self-care and self-respect. It allows an open floor to communicate the residents' wants and needs, and setting boundaries allows your resident to make time and space for positive interactions and set limits in any relationship in a way that is healthy. Setting and maintaining healthy boundaries can help reduce anxiety, overwhelm, resentment, and many other problems. And so when we look at privacy and personal belongings, this can look like a resident requesting the staff to not go through their drawer or belongings without their permission. Sharing personal information, this can look like a resident choosing not to discuss sensitive topics about their past with other residents, stating, I prefer not to talk about that. Decision making regarding care, a resident asserting their right to choose which medications they will take or refusing certain medical procedures. And then social interactions. This can look like a resident politely declining to participate in a group activity due to feeling tired, stating, I appreciate the invitation, but I like to rest in my room this afternoon, but clearly communicating that their preference for privacy and personal space without feeling obligated to join activities when they don't want to. And so this communicates to staff that they want their personal space, privacy, decision-making anatomy respected, and that they expect staff to adhere to the professional limits in their interactions. Essentially, this indicates a desire for a respectful and dignified care experience where their wishes and preferences are considered paramount. And so this can help clients feel more respected and know that they are being heard. So now let's get into discussing the relationships between boundaries and values and educating your residents on how boundaries and values intertwine. And so values are a person's beliefs and principles that guide their actions, decisions, and priorities. They are the core of who someone is and can be used to determine how to live and work. Values can vary across cultures, time, and individuals. Now, values essentially represent what residents deem important and desirable in their interactions with the service provider or company. It encompasses their ethical standards, priorities regarding quality, customer service, and overall approach to business dealings. Now, values can be defined as broad preferences concerning appropriate courses of actions or outcomes. As such, values reflect a person's sense of right and wrong or what ought to be. And so, what is the purpose of values? The purpose of a resident identifying their values is to provide a guiding framework for decision making, ensuring actions align with what they believe is important, leading to a more fulfilling life by creating a sense of purpose, authentic, and integrity in their choices and interactions with others. So essentially, actions as a is acting as a compass to navigate their life's complexities and make ethical decisions based on personal beliefs. So when residents have different values, conflicts can result. Ethical decision making often involves weighing values against each other and choosing which values elevate. So for residents, understanding and defining core values is essential for leading an intentional, and fulfilling life. So, how do we help our clients or residents define their values? And so, one, we need them to identify a time when they were the happiest. So, you can ask them or ask themselves, what were you doing? Well, who were there others? And what other factors contributed to this experience? Identify a time where you were most proud. Again, ask yourself those same questions. What were you doing? Were you with others? And what other factors contributed to this experience? Identify the times when you were most fulfilled and satisfied. So ask yourself, what need or desire was fulfilled? How and why did the experience give your life meaning? And what other factors contributed to feelings of fulfillment? Determine your values based on your reflections of moments of joy, pride, and satisfaction. So sort through your values and aim to identify and name your top 10, and then reaffirm your values. Look over your list and make sure they reaffirm and fit in with your vision and where you see your life. And so making sure that your clients can identify their values, and that's going to really help them set boundaries. Now, this is a values clarification handout. And so this is a great tool to use with residents or yourself to identify what are your values. This can help guide conversations with your residents and then being able to identify what their values are. So do they value love? Do they value honesty? Do they value independence? Do they value success? Do they value family? So it really helps your clients be able to identify what their values are. And so boundaries are a way to live out your values and priorities by establishing limits that protect your well-being. So they are based on the core values, which are your resident standards and principles in life. So boundaries help us live our lives and priorities by setting physical or emotional limits that protect our well-being, mental health, and comfort. So they're a type of self-care and a life skill we can keep learning, practicing, and improving. So by consciously developing boundaries that align with your values, you give yourself the safety, comfort, and freedom to be who you are. So healthy boundaries help us protect our value system, and many values have to do with our personal story and history. They are those qualities, people, behaviors, and things that we hold important and that are worthy to us. And so we can identify our values by noting how we invest our time, money, and energy. So looking at boundaries and values. So identify your values. Consider what makes you feel fulfilled, alive, and balanced. Set priorities. Make a list of your top priorities and how you want to spend them and spend your time. And reflect your values. Continually reflect on your values and standards and uphold respect for yourself. Set boundaries to protect yourself. Set boundaries to protect your energy, mental health, and capacity. Communicate your boundaries. Let others know what you need and why it's important to you. Keep boundaries flexible and be kind to yourself. So boundaries are a type of self-care. So make sure that you are being kind to yourself. Value system and boundaries. And so our values are the guiding principles that shape our decisions and actions. And our healthy boundaries act as a protective barrier that ensures we do not compromise those values in our interactions with other people. Personal story and values. And so many of our core values are formed based on our life experiences, upbringing, and significant events, which contribute to our unique perspective on what is important. and identifying values through actions. So by observing where we invest our time, money, and energy, we can gain insight into what we truly value most. And so understanding your personal values. So kind of asking yourself this question: what are some of your important things that you consider of value to you? So 1, we need to reflect on your experiences. 2, we should be identifying your role models. 3, look at patterns. 4, consider your beliefs. And then 5, prioritize your values. And so we essentially safeguard the things we consider important in life, which are often deeply rooted in our own personal experiences and define who we are as individuals, or what we identify as important things are our values, and we understand them by observing where we allocate our time, resources, and energy. And so values are fundamental beliefs that influence our actions and decisions, determining what we consider important in life. And so just some ways to understand, or some examples here, when we're talking about values, so one of my values may be spending quality time with my family. And so one of my boundaries also related to that value is that saying no to extra time at work commitments that will significantly cut down my time with my family. So if I have a project and it's taking me over 5 o'clock, I want to be considerate of my family time, since that is a value to me. I value spending quality time with my family. All right, so now we're going to look into how to help residents set and maintain healthy boundaries. So as a staff, you can clearly communicate your own professional boundaries, actively listen to residents' needs, educate them on what healthy boundaries look like. You can also role play scenarios to practice boundary in specific settings, but you want to encourage self-awareness of their triggers and consistently reinforce the importance of respecting their own limits, while also ensuring they are not overstepping your professional role by providing appropriate support and guidance. And so setting healthy boundaries can look like establishing clear expectations. So discuss your availability, communicate protocols and scope of services to set clear framework for relationships. For example, how are dining services staff different from activity staff as far as the services provided? Validate their feelings, acknowledge their concerns about setting boundaries, and emphasize that there is a sign of self-care to protect their needs. Identify potential boundary violations, and so discuss situations where boundaries might be crossed, such as personal information sharing, contact outside of the facility, or exchanging gifts. And then teach assertive communication. Help residents practice saying no confidently and clearly expressing their needs when necessary. Role-playing exercises stimulate situations where boundaries might be challenged to practice how to respond appropriately. Encourage self-reflection. Guide residents to identify their personal triggers and situations where they struggle to set boundaries. Educate on benefits of setting boundaries. So explain how healthy boundaries can enhance self-esteem, reduce stress, and maintain healthy relationships. Respect their pace. Allow residents to gradually implement boundary setting strategies at their own comfort level, and provide positive reinforcement. So acknowledge and praise their efforts to maintain healthy boundaries. Now, assisting residents with setting healthy sexual boundaries for themselves. And so residents with sexual boundaries clearly define and communicate their comfort levels regarding physical touch and sexual behavior within a relationship. So staff have a responsibility to ensure that the boundaries and interactions with residents remain appropriate and do not cross into personal or sexual territory. So staff should not be sharing personal information, especially personal sexual information. And so in our next couple of slides, we're going to discuss how staff can assist their residents with setting and having those healthy sexual boundaries. So staff can ensure residents are aware of their sexual boundaries. Sexual boundaries are essentially about defining what level of physical touch, intimacy, and sexual activity they are comfortable with, including when, where, and with whom they engage in their sexual activity with, and clearly communicating those limits to others to ensure their personal safety and respect in sexual situations. So staff may review a resident's concepts like how people touch your body. This can include over or underclothing or your body parts, how people see your body, such as being naked, partially naked, or dressed in a sexual way, how people treat you in sexual situations. So this can include how they speak to you and what the relationship is, and then what you're comfortable doing to others. And so, such as what ways do you touch their body? And so educating your residents to communicate sexual boundaries can look like being clear. Think about what is comfortable or what they're comfortable with and what their limits are. As always, communicate. Talk about your feelings and listen to your partners with respect, asking for consent. So ask questions like, is this okay? Are you feeling comfortable? Check in with your partner's comfort level during sex, and then respecting boundaries. Respect the boundaries of your partner. Just ensuring that your clients are, if they are engaging in a sexual relationship, that they do have boundaries and that they know what those boundaries are. So here are some tips and resources to help your residents set healthy boundaries. If they are ongoing or complex boundary issues, please work with your facility's TBS worker or your facility's social worker on the handouts such as these to improve your resident boundaries. So the first one here is just a setting boundary handout. And so this worksheet will help teach your residents to set healthy boundaries by covering language for speaking assertively, boundary setting tips, and some examples and practices and practice exercises. So it kind of goes into helping your clients or your residents know their boundaries and then what to say when they are trying to set that boundary. This is another activity. So these are examples, may also be used for role-playing scenarios. And so it gives a situation and a response. And so you can kind of role play this with your resident on. So the situation is you're invited a friend over for this evening, but now it's getting too late. You would like to get ready for bed, but your friend seems unaware of how late it is. You can teach your residents how to respond and how to have that assertive communication. Hey, it's getting late. I have to get up for work in the morning. Whatever that role play situation is, you want your client to be able to understand how to have that and how to have that assertive communication. So to get the most out of the practice, encourage your residents to treat the scenarios as if they were actually experiencing them. What language would they feel comfortable using to set that boundary? And so that is all, folks. And so let us know how we did here. I want to appreciate you all for taking our boundary training. And hopefully with taking this training, you have now developed a greater understanding of how to help yourself and your residents set healthy boundaries. Thank you.